I did have a number of patients on the trial, which is why I presented the poster. So there were two studies which of liso-cel CAR T cells, one done in Europe, the TRANSCEND WORLD study, and then the other done in the US, the platform study, which treats aggressive large B-cell lymphoma patients with liso-cel CAR T cells. And the qualitative analysis done as part of the study was to see, because this is a new treatment modality, to see how does this all impact patients and their quality of life. It's not as easy as taking a pill. It's not like getting chemotherapy, which people may be more used to getting. It's really a new form of treatment. And so there were a number of interviews that were done as part of these trials, if the patients, of course, gave permission. And the time points of these interviews were, before, at baseline, before their cells were collected, and then before lymphodepletion, and then again after, immediately after, or I should say the first time point was screening, the second time point I think was at leukapheresis when the cells were collected, and then the third time point was right after lymphodepletion followed by CAR T cell infusion. So there were 3 time points where interviews were done, and the qualitative analysis was to compare the different time points and see, what were people's perceptions of what they had gone through. So what was found was that early on in the process, in the interview 1 and 2, they were a little bit more concerned about side effects, about whether or not the treatment will work and things like that. But after CAR T cell infusion, majority of patients basically were pretty happy with how they had tolerated the infusion with little or no side effects at the time of infusion. And of course, there are other time points where the interviews will then be assessed subsequently, meaning, several weeks after CAR T cells, what were the side effects and quality of life, and then longer term as well, once they get over all the side effects, et cetera. So it's an ongoing process, but really just a way to show people's quality of life and their perceptions and their concerns about this newer treatment model as part of ongoing, prospective trials.